Okay, so welcome everybody. My name is Professor Cass Noakes from the University of Leeds. I'm the lead for the Future Urban Ventilation Network, and also very privileged to be hosting today's event on behalf of the network for World Ventilation Day. I think many of you are aware of the Future Urban Ventilation Network already. We were funded over the past 4 years through the UK Research and Innovation funding system, and through the network we've built together a community of people and resources around how we the importance of ventilation in buildings for improving indoor air quality. And through that network, we've developed a number of resources, we've developed a data repository, we've started really quite substantial conversations around how we observe indoor air in building, and we've hosted a number of events and activities for the community. And of course, of greatest importance for this was an event that we helped kick off 3 years ago now, which is World Ventilation Day, and we designated the 8th of November every year to be World Ventilation Day. This is the 3rd year that we have run World Ventilation Day, and it really is a world event. It is we have people from all over the world. We have people in Australia, across Europe, across America, and many other places who contribute to World Ventilation Day. And if you've not been on your social media, you know, get on there and say things about how wonderful ventilation is and why indoor air is so important. The focus of this year's event is around enabling action, and it's really thinking about how can we learn better about the ventilation in our buildings, and how can we help individuals, businesses, communities, public buildings, etc., to improve the ventilation and indoor air quality in their environments. And that's where the theme for what we are doing this afternoon comes in. So the focus of this event is around how we build that evidence to improve ventilation, how we take some of that evidence into practice. And I'm really pleased that we've got a great set of speakers for you today. We've got people who have worked in research, in the NHS, and who sort of deliver change in practice, who are going to be involved in our sessions today. We've got our first set of the first part of the day, for the first sort of hour and a bit, is going to be sharing the outcomes from a number of research studies. And so we've got 5 speakers here who are going to talk at some different scales of studies and from a number of different settings. So we will cover schools, small businesses, homes, large event venues, and healthcare in those. And then we're going to open up into a panel discussion where we have 5 panel members who come from, again, a range of different backgrounds, who will bring both some of the practical technology aspects of this, but some of the real world challenges around delivery and how we engage with individuals and communities in order to deliver better ventilation in environments. So just before we kick off fully, I would like to go through a number of housekeeping things. We have a lot of people signed up to this. We have over 200 people who are planning to come to this, which is amazing. We're really pleased to have so many here. We've got people from all different walks of life who've come along to listen today. Please can I ask for your help in helping this run smoothly? So if you are not a presenter and you're not a panel member and you're not involved in speaking, please can you stay muted with your camera off? That just makes our life that much easier. With such a large audience, it's really hard for us to take questions spoken. So please, if you have questions, put them in the chat. We are quite tight on time. We may not be able to answer all the questions. We will try our best to take many of those questions and answer them afterwards if we're not able to answer them during the event itself. Different people will say different things in here, and not everybody's views will necessarily concur with what you think is the best way to do things. So, but please be respectful of that, both in how you ask questions, and any other comments you might make in there. An event like this, so far, looks like it's going to run smoothly, but they do sometimes hit technical challenges. If we do, just please bear with us on that. You will have seen we're recording the event. We hope that we'll be able to put some of the event up online on our YouTube channel afterwards, and sit back and enjoy celebrating ventilation with us. So without any further ado, I'm going to go over to our first speaker of today, who is Dr. Sam Wood from Imperial College, and Sam is going to talk about the SAMI project and schools air quality. So over to you, Sam.
Hi there. I'm Sam. I'm going to talk a bit about the schools air quality monitoring for health and education. So this is the SAMI project, which some of you may have heard of, and specifically how we can use this to assess classroom ventilation rates on a national scale. So the SAMI project uses a novel method in which we engage schools by giving them indoor air quality monitors, and then we support them to get connected. We deliver them a web app, which includes interactive graphics that lets them engage with their own indoor air quality, and also includes a number of activities to help them deliver lessons and better understand their own data. So this empowers schools to understand their own indoor air quality and how they might improve it. And at the same time, it gathers us a lot of data which we can use, which we can feed back to schools to help them improve air quality, as well as publishing research. So over the 2 years the project ran, we recruited over 1,300 schools and deployed a monitor to each one. And we gathered air quality data from more than 900 of these monitors. So the first year of SAMI's operating, we gathered more than 40,000 schools days of usable data. This year, it's more likely to be something like 100,000. And then we also co-designed the SAMI web app to support schools to explore their own data and gave them activities to use. We've provided a huge amount of publicly available resources about indoor air quality, published a number of papers, and in addition to these papers, for each one, we published a summary document which goes back to schools in more sort of school-friendly language to help them understand how their air quality data is shaping research. So I'm going to be talking about the first full term of SAMI data, which was the term of September to December 2023. And see what this tells us about ventilation in UK schools. So we sampled our SAMI schools in the interval from September to December, looking at a total of 58 school days. And we had 322 schools providing air quality data during this period, and about 190 of them met the criteria of the study. So on any given day within this study, we had at least 122 SAMI schools providing us with air quality data spread all throughout the country. And then we combined this with a number of external data sources to see what factors would influence school-wide factors would influence school ventilation levels. So we looked at outdoor weather data, we looked at statistics relating to deprivation, poverty, index of multiple deprivation, we looked at whether schools were rural or urban, we looked at characteristics that came from their energy performance certificates, and various other school-wide statistics just to understand classroom ventilation. And you can't really talk about ventilation in classrooms without talking about the weather conditions, because obviously the vast majority of classrooms in this country are naturally ventilated. So when it's warm, people are obviously more inclined to open the windows. So this has a big impact on the ventilation rate. And so we can see this plot here showing the temperature both in SAMI classrooms and outdoor over the term. So the green line showing the average outdoor temperature and the blue line showing the average temperature in SAMI classrooms. And we can see there's sort of 4 distinct weather periods. This is an initial really warm period before half term. And then there's a much colder period later on and a couple of sort of intermediate periods. And we can see this lines up nicely with the CO2 levels that we've measured in our SAMI monitors in our classrooms. So as we'd expect, the CO2 levels are generally quite a lot lower during this warm period and higher in the cold period. And we also show on top of this red dashed line is the BB101 guideline, the daily mean CO2 level guideline for naturally ventilated classrooms. And actually, we can see that most of the time, most schools adhered to this guideline, apart from during the cold period where the interquartile range, which is showed in the shaded area, quite regularly goes over this guideline. So we can see a significant number of schools were breaching the guideline during the cold period, but most of the time, most schools met this guideline. And we can see that this guideline is really closely correlated with the outdoor temperature. So the x-axis of this plot shows us the mean school day outdoor temperature. And on each given day, we can see the fraction of SAMI schools which exceeded this this guideline. And we can see that obviously when it was cold, far more schools did. But still, when it was, you know, freezing cold, only about 20% or so of schools were going over the BB101 guideline. Now, of course, this guideline is written in terms of CO2 levels, but doesn't actually say anything with regards to ventilation rates. Now, one of the reasons for this is that direct measurements of ventilation rates is very difficult in schools, especially during occupied hours. I don't think there's been any study really which has looked at occupied classrooms in order to find the ventilation rates. However, we now have a fairly novel method of estimating ventilation rates based on the integrated CO2 measurements over the course of an entire day. And we found that this works even with very limited contextual data. So using this method, we can estimate the mean per person ventilation rate, or the distribution of mean per person ventilation rates in a classroom based on the integral measured CO2, the estimated average per person CO2 generation rate, which we can estimate, well, I mean, we know how this varies for different populations, the typical classroom occupancy time, and also this statistical factor, which I won't go into. And in this way, we can take easily made measurements of CO2 from our SAMI monitors, and we can translate these directly into distributions of per person ventilation rates. So we can see, as we'd expect, the ventilation rates shown in the right plot are generally much higher when it's warm and lower when it's cold, which is pretty much as expected. But this is really important for indoor air quality modeling because CO2 measurements don't let us model indoor pollutants directly. We really need estimates of ventilation rates in order to model how pollutants go in and out of classrooms. And it's not just about modeling. Having estimates of the distribution of ventilation rate can also inform design and guidance. So, for example, we can get the distribution of ventilation rates over this whole term, and we can find that the overall mean ventilation rate was about 5.3 litres per second per person, averaged over the whole term, and we fell to as low as 3.8 litres per second per person when it was cold. Now, I think we should contrast this with the fact that schools generally met the CO2 guideline because these are really low ventilation rates. So we've inferred the ventilation rates are very poor, even when schools are consistently meeting the CO2 guideline. We also want to see if various school-wide factors have an impact on classroom ventilation. So we looked at indicators of wealth and deprivation, and we looked at various other school-wide factors just to see if there were any which had a really significant impact both on CO2 levels and on ventilation. And we found that when we controlled for outdoor temperature, the classroom CO2 levels were heavily affected by whether or not schools were fee paying. So private schools generally showed higher CO2 levels, perhaps to be expected. And similar with index of multiple deprivation, schools in poorer areas generally showed higher CO2 levels. Schools with more students relative to their sort of maximum target number of students generally, again, as expected, showed higher CO2 levels. And whether or not a school was primary or secondary had a statistically significant influence on the CO2 levels in that school. Now, how does this relate to ventilation rates? Because we don't necessarily expect primary or secondary schools to be ventilated differently, but they follow the same guidance. So we performed the same statistical test using average per person ventilation rates, which we've inferred with this method. And we find that still private schools are better ventilated than state schools. Schools in wealthier areas are likely to be better ventilated, and schools with fewer students have a better per person ventilation rate, which we expect. But we find that education phase does not come into play here. We find that primary and secondary schools have similar ventilation rates, but primary schools generally showed lower CO2 rates. So what we've seen is that the CO2 guidelines do not consider how CO2 generation rates vary by age group. Obviously, older students are likely to give off more CO2. Primary schools are not better ventilated than secondary schools, but are more likely to meet the existing guidance. And I think it's really important to note that we're interested in ventilation and not just CO2 levels. So here's just a summary of the conclusions of this work. I will leave these up while I take any questions.
Thank you, Sam. That's great. And loads of time at the moment. So there's a couple of questions. I think one is, and you've sort of alluded to this already, which is a comment which says, well, it's a national guideline of 1,500 parts per million. It's actually too high for good health or good ventilation. And you've sort of inferred that in your discussion, but do you think that's maybe the case?
I mean, I think that's very clearly something we see. Yeah, if we see the guideline shouldn't really just be, I mean, I don't know how you would do it in a way that is based on ventilation rates, but looking at just the CO2 level alone doesn't paint the whole picture at all, because it doesn't really tell you everything about ventilation rates. We should be looking at ventilation and not just CO2 levels, which obviously the guidance doesn't.
And I think this is a clarification. The statistical factor which you mentioned, M, regarding daily average per person ventilation, that's calculated from your data set, is it? Rather
this is calculated based on various, yeah, so we look at how, well, I didn't actually complete the work that leads to this factor, but it looks at the distributions of all of these various school-wide properties expected over all schools in the UK, and basically by doing the statistics that leads you to this method, you end up with a sort of factor which takes into account the degree of uncertainty you've got based on all of the things you don't know, but you know the distributions over all of the classrooms.
That's great. Just a couple more brief ones. And there's a comment around somebody who's got some data that you might be interested in, and they've left their details, so probably look in the chat for that.
Oh, brilliant, thank you.
Question which is, what are the main pollutants that you're concerned about in schools?
I mean, PMs are probably, well, they're the ones that have the advantage that we have the most ability to monitor them directly. So I think within SAMI, we're increasingly finding that most of the PMs in classrooms are really dependent on outdoor particulate matter levels. So yeah, those are really the sort of key ones. And of course, CO2 in itself affects classroom performance. We'd like to study that a bit more. And then, of course, one that we haven't talked about here, which relates to PMs, is the spread of infectious airborne illness, which obviously is, you know, if it's droplet borne, will be influenced in the same way that we influence PM levels, but cannot be measured directly with this method.
Mm-hmm. And then I'll ask one more question, which is, what ambitions does SAMI have now based on recent studies to enhance or focus it to research to better understand ventilation instead of CO2? Is that where you're really thinking of going?
Yeah, I mean, we're still working very hard to make sure that the data that we generate based on the SAMI monitors that are present is being fed back to schools and into advising policy. At the moment, I am looking more into particulate matter levels, how that affects relates to ventilation rates. Also, how this relates to HEPA filters, the role of HEPA filters in classrooms, will they benefit in terms of improving air quality? Yeah, so we've got quite a number of things we're doing with this data.
That's great. Thank you ever so much, Sam. That's great. And I think we will move on now to our second speaker.
Thank you.
Thank you for giving that. And if you can maybe just have a quick look in the chat for some of the questions that are still coming in. So I'm going to hand over now to Dr. Abigail Hathway from the University of Sheffield, who's going to talk about some work they have done around looking at ventilation in small businesses.
Great, thanks, Kath. I think can you see my screen? The right one?
Yeah, it looks good to me.
Good. So yeah, I'm going to talk about small businesses. The work that we've done was largely around small scale hospitality businesses. So you can see on this slide in the table the sort of places we looked at. We did also look at some small independent gyms as well. But so some of what I'm saying is very relevant to more hospitality, but actually a lot of this was around places that are quite small scale. You can see there we've got some capacities in sort of bars up to about 300 people. So not huge places. Nightclubs getting bigger, 1,300, 1,800 people, still quite small for a nightclub. So 100-seater restaurants. And these were very much independently owned businesses based in Sheffield. So what's particular about these places is that they were small, independently run, and they didn't have expertise in building services on site. So there was no one really looking after the buildings and that side of things. And that's very particular to what we're looking at. And so the work that we sort of went through that I'm going to talk about was in 3 phases. So we looked first about, what are the technical and behavioural challenges to good ventilation? And part of that was first, is there a problem with ventilation? And, as Sam's been talking about, we use CO2 monitoring to kind of infer whether we've got good ventilation or very poor ventilation. We weren't trying to estimate ventilation rates on this. This work, as you might guess, came out of COVID. So it was as we were opening up from COVID to understand and try and help these places to improve their ventilation, because you had people sharing the air, and it was all done quite quickly. So we're keeping things simple on the CO2 monitoring. We then carried out interviews with the owners to understand what their how they understood the ventilation, particularly what their capabilities, opportunities, motivations and barriers were in order to improve that ventilation. And in order to get a better sort of understanding of this, we did a little bit of risk modelling and cost estimates, which I'll share a very tiny amount with. And then from that, we developed some guidance, which we then tested. And in that guidance development, that was based on the information we'd found in phase 1, but we also did a lot of engagement. We would try doing lots of engagement with business owners. It was quite hard at that point to get them engaged. They were much keener earlier on. Our first bit of work was doing the Omicron outbreak. But we did engage with about 200 environmental health officers in developing that. And then online, we were able to do a questionnaire of 63 business owners to refine that. So we've had a lot of input from people involved in small businesses in developing this. And then we had some testing of it as well. So in terms of that CO2 monitoring and that first question of what are the technical challenges, I mean, our first question was really, are there technical challenges or is the ventilation good? And at this point, there's sort of a lot of anecdote and very aware that you're in places you can't really see any ventilation. And we weren't, sure as engineers going to these places there'd be much, but we wanted to do some measuring. So as I said, this was CO2 monitoring in a range of different restaurants, cafes, bars and nightclubs we're showing here. And we've got our probability of exceedance curves here. And we've highlighted here that 1,500 parts per million that we've just been talking about in Sam's talk to highlight where things are poor as a kind of just a flag really to say, oh, is this looking particularly bad? And we also looked at the 800 parts per million as a sort of highlight for, is this quite good? And you can see here, if you look at the restaurants and the cafes, a large proportion of that curve is actually below the 800 parts per million. And then it's creeping up into that zone in between the two. And only a small amount of time is really creeping over the 1,500 parts per million. Unsurprisingly, when you look at the bars and nightclubs, you get a different picture. We've got much more crowded environments, much higher occupancy density. So, we'd expect this. We're seeing that CO2 level is getting up. And in the nightclubs particularly, it's getting very high. Now, some things to kind of say about this in terms of the systems in these spaces. As part of our work, we walked around and understood what ventilation systems were there and how we could easily or relatively easily improve them. In terms of the systems, for the restaurants that were performing well, we actually found it was a mix, whether they were mechanically ventilated or naturally ventilated. Some of these smaller restaurants with about 50 seats were able to naturally ventilate very well. And when they'd seen the guidance that, we should be opening windows, they were able to do that because they had windows to open. Equally, some of the worst performing restaurants had mechanical ventilation and hadn't really appreciated how to turn the fan up. Now, when we move to the bars and nightclubs, it's a different picture because of that capacity of people and equally the noise challenges, the need to keep things shut. Here, the better performing bars where they're actually keeping things below that 1,500 parts per million were the ones that had centralized mechanical ventilation units. And particularly, as I said, most of these were small businesses. Some of the bars, so one of the bars and one of the nightclubs were part of a larger establishment who did have building services expertise on site. And they were the ones that managed things particularly well. So you could see that benefit of having that expertise on site rather than having to buy support in when you think something's broken, which is the case really with most of the other places. And the nightclubs generally very high CMQ levels across all of them. So we're sort of aware here that we've got quite a lot of people in these spaces. They're closely packed, and this was at the end of COVID, so we're thinking particularly about that infection transfer, and clearly your close contact is going to be a lot higher in these places as well, which made us think about, well, how do you define the right level of ventilation? What is it for different places? Similar to what Sam was saying, what's your different generation rate with different people? And we did a little bit of an extra study on a case study of one of our nightclubs, just to try and understand a bit better what was happening there. So we did some infection modelling, and this was using the model of Ben Jones and Chris Idden that uses a population framework to predict the number of people infected. And so we're looking here just at that far field transmission of infection and the impact of ventilation rate versus halving capacity. And this enabled us to look at the probability of there being infected people within our spaces as well, which was really useful for this, because what we found, and I can't go into the methods in detail at the time, but what I think is really useful to share here. So you can see here, we did a comparison with a sort of an office that, when we sort of made up on the basic guidelines of what an office would be. We used one of our case study cafes and a case study nightclub. And what I'm showing here in this table is the percentage reduction in number of people infected from far-field transmission when we either double our ventilation rate or halve our capacity. And for the office and the cafe, the halving capacity had a greater impact on reducing infection, whereas for our nightclub, increasing the ventilation rate had a greater impact, which we're like, oh, that's interesting. And this is because we've incorporated in here the likelihood of there being people who are infected in this place. And with our cafes in our office, we've got such a small number of people that once you get, so this was a community infection rate of 1 to 100. And if you look at this at a population scale with lots of different offices and cafes and spread out the infected people randomly across that population, you'll have some offices and cafes without anyone infected. If you halve the capacity, that's more likely to happen. So you reduce the likelihood of there being someone infected in there. Whereas with the nightclubs, because our number of people is still so big, we're actually still likely to have at least somebody who's infected in the space. So ventilation has a bigger impact than changing the capacity. Now, that was quite a nice thing to see that, well, actually, if we double our ventilation rate, so from 5 litres per second to 10 litres per second per person, we get, a better reduction in potential infection. But in these spaces, that's a lot of air. So for these nightclubs, you'd be looking at increasing, for 10 litres per second per person, you'd be looking at 10 air changes per hour. So that's 10 times the entire volume of that space air is basically, well, it's not refreshed, but that type of volume is moved through 10 times within an hour. So if you think about how big the volume of space can potentially be, that's quite a lot of air you're moving. And in terms of costs, this is a big improvement that we're asking people to do. It's not so saying open your window. So just to put that in context, if we were to add new systems to these places, if we were to do a smaller system at 5 litres per second per person, it'd be about £190,000 for our case study nightclub here. For 10 litres per second per person, we're not doubling the cost by doubling the airflow, but it's about 70% more. So it's still a substantial increase in that £330,000. Just because the amount of airflow is getting so high, the amount of ventilation infrastructure you need is really important. The costs are quite high, so include planning, asbestos surveys, things like that. What they don't include, though, is increasing your power supply to allow for this, which might be required if you're, again, going to vastly increased ventilation. The one thing to note, though, from a technical point of view, bars, a lot of them were quite a bit smaller, and that ability to ventilate with fans provided in the walls is a lot more possible, which is substantially cheaper. So the real reason the nightclubs get so expensive because you've got so much air, and with the size of the space, you're really needing a centralized unit with an air handling unit, ductwork, and everything that comes with that. So that was sort of the technical side. And then we also spoke to the venue owners, and this was what was particularly useful in terms of developing our guidance. And we found that stage people are very aware of the importance of ventilation in terms of reducing COVID, felt they had a responsibility to keep the space safe for their participants. But there were problems in terms of the opportunity and the motivation. One, is that a lot of people don't own their buildings. It's the landlord that owns them, so they're not wanting to put any money into really improving that building because they're only on a lease. And then in terms of motivation, they've got two sides of that are important. One, the customers are always right, and thermal comfort is most important for the customers for most places. So the restaurants that were doing a really good job were the restaurants where they were aware that their customers really cared about coming to a safe space. They had an older clientele. So they were able to say to their customers, well, we're keeping things safe, but you need to keep your coat on in here. The other side of things for the bars and the nightclubs, the noise complaints put their license at risk. So they really weren't concerned with ventilation. And then what came across really clearly with everyone we spoke to is that a lot of the guidance they'd seen out there, they knew they needed to improve ventilation, but all they could see was that apart from saying open doors and windows, there wasn't a vast amount of guidance. And for these particular venues, opening doors and windows wasn't really viable, or, one door for a large venue. You don't have any open windows, you have the noise problem. It just doesn't work for you. So that led us to develop our guidance, and this is a picture of the guidance. I'll put a link so you can download it when we finish doing this talk. And this is kind of an A4 sheet. And we're working closely with environmental health at this point. So the idea is this is something that can be taken out and given to people in their hand when they felt there was a concern. And what this run through, I don't expect you to be able to read this. I'm going to zoom in a minute. It runs through a motivation and then actions you can take at the short, medium and long term. So the motivations, we we're using existing literature to understand the benefit of ventilation, but we really focus here on partly that increased infections, but really importantly, that reduction in staff sickness that's been shown by increasing ventilation, because that was a really key motivation for these business owners. One of the things we're struggling with at this point, coming out of COVID, with Brexit, everything else, having the staff in to work who then kept getting sick was really problematic. So we focused our motivations around what people found were their big challenges with their business. We've then looked at short-term actions people can take, which unfortunately have to be really opening the doors and the windows. There's not a lot else you can do in the short term, but we focus this on worried about keeping customers warm for the winter. So really tackling that issue with thermal comfort, and then talking about the fact you only need to open things a little bit. So instead of just saying open windows, saying how can you do this and stay comfortable. Medium term, we were looking at that energy costs, so using a CO2 monitor to help balance how much ventilation you're doing, because some of our good places are actually doing very well and could have probably reduced things a bit and not spent so much money on heating. And then again, worrying about noise and promoting the idea of using an air cleaner inside, because that's a way to clean your air, even if you're not ventilating, without having to open the windows and worry about that noise side. And then finally, we talked about mechanical systems. And here we highlighted the idea of wall-mounted fans, because we'd seen from other than the nightclubs, all these other small businesses we looked at, that's entirely viable, and it's a much cheaper option and it's much easier to install. So really looking at a bespoke solution for those people. So we created this guidance, and then we went out and tested it on 9 venues. I don't have a lot to say about the methods because of time, but we're struggling at this point to get people as engaged as they were earlier on when we had 20 venues, which was a bit of a shame. So we did testing on 9 venues in person. We were able to do CO2 monitoring in order to see if there actually was a difference in CO2 levels with ventilation actions. And these people also did a behavioural diary. So we had a week where we just monitored and they did a behavioural diary. We gave them our guidance, and then we had another week of monitoring afterwards. Again, shorter than we'd like, but we only had funding for 3 months, so we had to keep things quite small here. And then we also did a big online study where we had, and I've not put the numbers on there, but that was nearing 200 people that responded, business owners or managers. And they just looked at the guidance and carried out an acceptability questionnaire on that guidance. Now, from the online testing, we were really pleased that 83% said when they looked at it, they'd like to do the short-term actions. And then we were really disappointed because actually we got a reduced likelihood of using air cleaners or installing mechanical ventilation once they'd seen our guidance. So they're more likely to do it before they saw our guidance, which was a bit disappointing. With typical thoughts, we think about this having done the rest of the studies. One, we included costs on there for those air cleaners and mechanical ventilation, and that might put people off because it is quite costly. Also, we suspect, having done our work in person, that it may just think that they can do the short-term actions, they've done them, that's good enough. Whereas with the in-person testing, we're able to go in and look at the CO2 monitoring, and we know a lot of the places were quite when they saw the CO2 readings, they were quite surprised. So they were initially very positive, their ventilation was fine. And then they saw the CO2 readings, they were like, oh. So in those venues with the behavioural diaries, we saw, so 3 out of 6, so only 6 venues actually did the behavioural diaries out of the 9 we were monitoring. So 3 of the 6 who did the behavioural diaries increased their ventilation actions once they'd seen the guidance. And then out of the 7 that did our questionnaire before and after, 2 of them were more likely to purchase air cleaners and 1 more likely to install mechanical ventilation. So not much change again on the air cleaners and mechanical ventilation, but a bit of change, which is pretty positive. And we can't say anything statistically, it's such a small number. But one thing I guess worth pointing out here is these venues, we particularly chose ones where the short-term actions would probably have an impact, so we could see if it was actually working and the way people would be able to do that. So, and we did see with our CO2 monitoring that those short-term actions were able to have an effect on the indoor air quality. So the people may have thought that was enough. So from this, we have recommendations that, clearly these venues with high occupant densities are struggling to meet the CO2 limits. And there's a big difference across even hospitality, those small and larger scale spaces. So we really need bespoke guidance. These places are completely different to the schools we've just looked at. They're going to be different to the other places we look at. And we need this guidance to be bespoke for those particular places. A lot of people said when they saw this that this was exactly what they were looking for. because it was tailored to them. From what we found in our testing, we would suggest that for this particular guidance for small businesses, actually using this guidance in combination with CO2 spot checks, which can be done by environmental health officers to identify whether improvements are needed or not, would be a good way to go forward. And thank you very much. That's everything from me.
Thank you, Abigail. That was great. Just got time for one or two questions. I've got a question which is around whether the estimated cost of increasing ventilation in the nightclub scenarios include ensuring no noise mitigation measures as necessary. So did you think about that side of it in the cost?
So the cost included the noise, did include the noise mitigation measures.
Yeah.
So for the fans and the systems, I'm assuming that's what the question's about. So the fans themselves can cause a noise problem at night, and that included the acoustic.
So included the mitigation of noises from the fans. Yeah. That's great. And there was another comment about infection rate used was potentially a bit low in the calculations. I mean, I guess it was representative of a particular time, but I did wonder whether, you know, if the infection rate changed, say it went to 1 in 30 or 1 in 40 or whatever, what might that look like? Would do you think you'd still get the same results?
So we tested 1 in 200, 1 in 100, and 1 in 50.
Yes.
So 1 in 50 was similar results to what we'd seen there in terms of that ventilation rate was still important for the nightclubs. I think at 1 in 50, the cafes, it got closer, that the ventilation then became more important for the cafes at 1 in 50. I deliberately chose a lower one to be more of a, I guess, a risky time.
And one last question, this was quite interesting. In the diaries, did any of the venue managers mention that they would brag to customers or staff about their good indoor air quality?
So we had one really engaged venue who, and not so much that they bragged about it, but they were like, we need something for our customers because the customers keep shutting the door. So this is really great for us, but actually we need something to tell the customers why we're doing this.
Okay.
But yeah, nothing about them saying they were doing it to their customers. I think there was a feeling at that point that people weren't that bothered any longer.
Okay, that's great, thank you. I'm going to move on now to our next speaker, so thank you, Abigail. Our next speaker is Professor Tim Sharpe. So Tim is from the Department of Architecture at the University of Strathclyde, and he's going to talk to us about some of the work they've done around ventilation provision in homes. So over to you, Tim. And I can't hear you at the moment. Tim, you're on mute, I think. Think I can, maybe I can unmute you? No, I can ask. Oh, there we go. Hang on, try again. Try again, you're still muted. You're still showing muted at the moment. Just try that again.
Okay, how's that?
Yes, we got you now. So if you can put your
I think we were both pressing the same button at the same time, and
if you can put your screen up then that would be great.
can you see my slides okay?
I haven't got your slides. We've got your screen but not the slides. Perfect.
Right,
there we go.
Okay, great. Okay, afternoon everybody. So I'm going to talk about a particular study we did in the publication which came from that, which is available, so you can go and look at that for more detail. It's a survey we did on ventilation provision and use in homes. It's a national survey. So it's myself and Karen Van Rooyen from UCL, who I have to say did most of the heavy lifting on the preparation of this, and certainly the number crunching around it. So this is about homes. We all know what homes look like, and that's sort of one of the problems. We know what they look like from the outside, but what they look like on the inside is very different. These are all photographs I've taken in the last year in homes, sort of pretty much in that previous picture. So there is a pretty significant problem, and it persists. We know that there are significant relationships between damp and mold health and indoor air quality, and we've known that for years and years and years. And interesting, if you look back, a lot of the problems which first arose with sort of post-war housing led to changes in building standards and requirements for introduction of ventilation and so on, which is good for new homes, but of course didn't particularly apply to existing homes. And more recently, clearly there's a lot more interest about indoor air quality more generally. Damp and mold still big issues, but other issues around pollutants, risk of infection, and so on. So that was sort of the motivation. The motivation for this study is that firstly we've got a pretty poor understanding about actual performance of buildings. There have been quite a few studies, but they tend to be fairly small. But they also tend to pretty much say the same thing in terms of finding poor ventilation and lack of provision and knowledge. And obviously, as we go into the climate change stuff, issues of overheating, health, energy, all of these things are important factors in contemporary housing. We also have a lot of existing homes, some of the oldest stock in Europe. So what's the story there? So the kind of key questions were, what is the national picture of ventilation in homes and how do people use it? So the study was funded by Future Urban Ventilation Network, and the publication is here, so you can go and look at that. I think we're also in the process of making some of the data available as well, but there's other studies which will come out of this. I mean, what I'll say here is I'm really just going to give the headlines of this, the top level stuff. I'm sure there'll be lots of questions for drilling down into more detail, but this is the kind of basic stuff. So yeah, how many homes have got minimum and adequate is an interesting distinction. In the end, we've gone with minimum, and part of that was a discussion with some of the reviewers, because we started off saying adequate, but their question was, well, is the requirement for building standards adequate? So we've gone for minimum. Is what is in there, is that what's required? And they're basically straightforward things. So it's making sure you've got extracts from wet rooms, bathrooms and kitchens, and you've got provision for makeup air, primarily through trickle vents. It's been in building standards for nearly 40 years now, since the 80s, and there's specific requirements since 1991. Of course, it's not particularly required for older homes, but of course, a lot of homes will have gone through various forms of retrofit and improvements, which may have changed that provision. So the study was taken a while back. It's a YouGov national survey, so that's a panel of people who sort of represent Great Britain nationally. I say it's Great Britain because it's England, Scotland, and Wales. The panel, the group, does broadly represent UK homes in terms of things, the listed gender, marital stages, but also importantly things like dwelling types, age, number of occupants, etc., etc. So the sample we had was actually pretty representative of what kind of national stock looks like. And we asked quite a lot of questions, 64 questions, so it's quite a long questionnaire. This is a panel of people who have agreed to be part of this panel, so we're not just kind of walking up to people in the streets and asking questions. And there were a significant number of variables that we looked at in terms of social dimensions, the physical dimensions of the actual type of house, heating, trickle vents, etc. We asked several questions about behaviour, which I'm probably not going to talk about much today, but it's how and why people use their ventilation provision. And then there was some other stuff, contextual stuff about people's health conditions and perceived indoor air quality and damp and mold, which I will mention briefly. So headlines then. How many people have got this adequate, let's say, minimum ventilation provision, and have they had any advice on to use that? So, yeah, headline figures: 45% of the respondents did not have mechanical ventilation in kitchens and bathrooms. 80% no accident in the kitchen, 33% nothing in the bathroom. 59% have trickle vents on some of the windows, only about 50%, 49% on all the windows. So if you combine those things and sort of say, well, okay, how many homes have got mechanical extract in the kitchen and bathroom and some trickle vents? Nearly 2/3 of UK homes, British homes, don't have that minimum provision. It's actually slightly higher if you say, well, it's trickle vents on all the windows. That's a pretty significant percentage of homes which don't have that. We also asked about whether people had had any advice on how to use that ventilation. Pretty small percentage were saying yes. And one of the interesting things about that is that there was really a lack of credible advice. People were getting it from all sorts of places, you know, friends and family, tradespeople, you know, adverts, sometimes housing associations, and so on. So if we're asking the fairly kind of blunt question, but how many homes have got all the provision that they should have and have had a good advice? 11%. That's a very small percentage proportion of UK homes. As you might expect, there was a difference. You know, the introduction of building regulations has made a difference. And older homes, buildings built before 1991, about 74% of them, you know, didn't have that basic provision, mechanical ventilation and trickle vents. You may assume, of course, that the older homes may be, you know, I can't do the italics here, but you know, well ventilated. You know, you'll have bigger homes. They will be bigger, leakier, have sash windows, open fires, stuff like that. I think there's a debate about whether a building being leaky means that it's well ventilated. It's leaky, but that doesn't necessarily mean that you're delivering ventilation air as and when you should do it. And of course, the other issue about, you know, lack of air tightness and so on is there'll be a significant energy and comfort penalty around that. You know, the thing to think about a lot of these homes is that most of them will have had some kind of improvements. I mean, kitchens and bathrooms are really common. Probably new windows are pretty common as well. So many really should have had some improvement in ventilation. And of course, what's happening more and more, and again, quite rightly, is that there are improvements in thermal performance, insulation, draft proofing, and so on, all of which will, I think, increase the reliance on that ventilation provision. You know, and I think there are some groups which have particular problems. So, you know, if you look at the post-war stock, for example, you know, pretty poor provision, and of course they will be homes which have other challenges, particularly around thermal performance, relatively small, etc. So that's an important element. One of the issues was about when we look at post-1991 homes. And so the sort of surprise here was that something like 35% of those are being reported not to have that adequate or minimum ventilation provision, or by analogy, therefore are not complying with building standards. You know, so some caution with this. I mean, obviously this is a survey. We're asking people questions. You know, we went to a lot of effort to make sure that people understood. So we had pictures of the trickle vents and extract and so on. So, you know, this may be unduly pessimistic in some regards, but that's still a fairly sort of significant proportion of homes which appear not to have what they should have in terms of ventilation provision. And the other thing to say is that, okay, there's that side, but when we have gone and measured buildings, often we've seen some significant problems with what is installed. It may be there, but whether it's properly installed, whether it's actually working. This is again a small study, but the number of extract fans which just weren't meeting their performance criteria was pretty significant. And this issue of kind of maintenance as well, making sure that everything continues to work. The one on the right is an extract in a tower block, and the advice was, well, you just need to clean it. You know, you're not cleaning it. That's why it's not working. We take that grill off, and that's what we see. So yeah, that's an issue. And of course, there are some issues about how people are interacting it. Again, from an older study, but you know, a lot of people don't really frequently interact with trickle vents, and often they are set the way that they were found when people moved in, and so on. There was some stuff about tenure. Again, there's probably quite a lot of threads which we are sort of continuing to pull on this. I mean, tenure was interesting. I mean, there is some sort of some good news there, because often a lot of sort of poor housing tends to be associated with landlords and local authorities. Actually, housing associations and local authorities, it wasn't brilliant, but it was doing a lot better than the other ones. And I think the one to kind of highlight there, both in terms of, you know, it's a fairly chunky percentage of the homes, and poor provision is private landlords. So in the survey, 22% of people were reporting some issue of damp, and of those, 72% were saying that they didn't have that basic extract provision. Again, just splitting that through the pre and post 1991. So in pre 1991 homes, 24% reporting damp, higher. There was a little bit less difference there between homes with and without minimum ventilation provision. So I think possibly quite a significant bit of the issue in those older homes probably is to do with thermal performance as well, which, you know, range of factors which will lead to damp and mold. And I think the point just to kind of emphasize really is that, you know, a lot of the requirements for ventilation introduced in standards didn't and still don't apply to older buildings. There is no retrospective requirement for that, generally speaking. Better in post 1991 homes, you know, but still 12% reporting damp. A bit of a difference there between the homes with and without, you know, minimum ventilation provision, which suggests that in those homes, you know, with better thermal performance, perhaps not brilliant, but better, ventilation may be having more of an impact. But, you know, better isn't good, and these next numbers are very crude extrapolations, but, you know, that's 18.6 million dwellings which don't have basic ventilation provision, and something like, you know, 6 million dwellings which have problems of damp and cold. Obviously, this is an ongoing issue. We are going to have to do lots of stuff to both existing homes and new homes in terms of improving insulation, making them more airtight. Nothing wrong with airtightness. You just need to make sure that the buildings become well ventilated. You know, and we do have this challenge, and, you know, it's part of the kind of last discussion as well, balancing good ventilation rates versus thermal comfort and energy consumption. You know, is a difficult thing. Often a lot of the discussion around damp and mold in homes, you know, does end up being somebody saying something about lifestyle. I think these things are overplayed significantly. Sometimes there will be issues about particular activities in the home, but generally speaking, most people are doing pretty straightforward things in terms of the home, in terms of, you know, cooking, breathing, washing, etc., etc. And I think the thing I'm going to take from this survey is that none of that stuff makes any difference, or very little difference, if you haven't got the right things in place, if you haven't got the right provision. That needs to be there first and foremost. So the last thing to do, I won't read these out, but I might actually, a series of bullet points really. You know, whether there should be a requirement for basic ventilation provision on homes, and that, you know, whether that should include existing homes, and this issue about, you know, retrospective requirements, what should we do about that? I think one of the issues that keep coming across is what is the penalty for non-compliance? What's the worst that can happen? The moment the worst can happen is that you might need to do what you were supposed to do in the first place, but that's not a big incentive. I think there is certainly something about making sure that things continue to work. If we agree that ventilation is important to health, then, you know, should that be an annual or regular maintenance requirement? A lot of stuff is driven, particularly thermal performance is very much driven by meeting SAP standards and getting the right numbers for that. At the moment, and I am reliably informed that the next iteration of SAP will have better stuff about ventilation, but, you know, that's not an issue. You can go and look at a building, an existing building, and it's got a reasonable kind of SAP score, passes a standard, but has no ventilation provision whatsoever. So that's an issue. And, you know, whether we need to be better at installing, improving kind of skills, both in terms of design, of installation, and indeed maintenance. So I will finish there and take any questions which anybody may have.
That's great, Tim. Thank you very much. I think we've just got time for one quick question, and I'm just going to pull from something in the chat, which is a comment on past 2035 retrofit standard, but requirements are pretty poor. And I wonder what your thoughts were on the quality of some of the standards that are out there.
Well, I think so the thing which is interesting about past 2035 is that it is a standard which applies to existing buildings, which doesn't otherwise exist. So I think that's useful. I think the fact that it is a standard which is trying to deal with the building as a holistic problem, as opposed to just a series of individual boxes, is extremely valuable as well. I think the challenge will be making sure we've got sufficient skills again for people to do that retrofit analysis, to do the design, to do the assessment, and then to do the kind of proper installation. But just because something doesn't exist now doesn't mean that it can't exist, and it's certainly a kind of goal worth pursuing.
Yeah, that's great. Thank you very much, Tim, for that. I think we probably need to move on to our next speaker, but thank you for sharing the information from those studies. That's great. So our fourth speaker of this afternoon is Dr. Ben Roberts, who's from the School of Architecture, Building and Civil Engineering at Loughborough University. And Ben is going to talk about some of the Airbods project, particularly focused on large events.
Thanks. Can you see that?
Yeah, I haven't got it. It's not on full screen at the moment. There we go. Perfect.
My name is Ben Roberts from Loughborough University, and I'll be talking today on behalf of the Airbods team about some of the work we did to reopen mass gathering events after the COVID-19 lockdown. So it was a really big team involved. So just to say up front, thanks to the team, there was a lot of us. You can have a look on the URL there. Many aren't pictured in there, but there's a few of us who were involved in the project. So as we know, and as we've spoken about at the start of the pandemic, we started to understand that the way the SARS-CoV-2 virus was moving was through the air, through airborne routes. And so we suddenly became quite concerned about aerosols and droplets moving between people. And then the government realized, well, where's this happening? It's primarily happening in large mass gathering event venues, places like music festivals and football stadiums and theatres. And so the government approached us alongside our work with Airbods to work with them on something called the Events Research Programme. And the Events Research Programme was a big body of work funded by the government with various different elements. And we were involved in the environmental study, which was led by Dr. Leora Malky-Epstein, who you can see on the photo there on the right-hand side, collecting our CIBSE silver medal a couple of weeks ago on the back of that work. So what we were asked to do was to assess the risk of reopening mass gathering events from a ventilation perspective. So we took the approach that we would measure CO2 as something that is relatively cheap and easy to do, and use the indoor measurements of CO2 as a proxy for exposure to exhaled breath. We weren't looking to necessarily make connections between the CO2 concentrations and infection risk. That was actually done in another part of the project by Chris Idden and Ben Jones. But primarily the focus here was a rapid assessment of CO2 concentration and ventilation relative to the occupancy provision. And so linked within that occupancy angle, we also counted the occupants that were in the space, and we worked with a company who were using CCTV imaging to count where people were and for how much of the time. So the Events Research Programme was the largest programme of its kind worldwide, and still is to my knowledge. And it was all about rapid evaluation of ventilation performance. So some of the things we were doing were were governed by the time constraints rather than necessarily if we were given plenty of time and a bit more money to do it. So what we were trying to do was identify pathogen risks, and we did this during April and June 2021, so sort of right in the middle of the COVID pandemic. And at that time, all mass gathering events were banned. People weren't allowed to attend them, except if you're going to an events research program event. And during those events research program events, you're allowed to basically behave under pre-pandemic conditions. So this was the first time that people were allowed to mix with other people, take their masks off. They weren't required to physical distance. So it was really a great experience for us and the participants to finally feel a bit of freedom after being locked down for so long. We monitored several events, including a business conference. We monitored a nightclub, FA Cup final, the O2 at Wembley. Sorry, we measured the Brit Awards at the O2 Arena, the World Snooker Championships. We looked at horse racing, a music festival, and then various other different theatre events. So you can see why the team was so large, because we were covering a lot of events. So we developed these air quality bands as part of the project, and they were published in our Berserk paper last year. And they basically used the range of CO2 values that we were recording to try and give an air quality band classification, with A being at or marginally above outdoor levels, and then G was being very low ventilation. And what we found was that on average, most venues were actually pretty good. They were, the air quality or the ventilation relative to the occupancy was relatively good, but there were a couple of events in particular which were cause for concern, and I'll talk about those now. So the big one was the nightclub on the 30th of April and 1st of May 2021. So you can imagine this is a big Victorian warehouse with 6,000 people shoved inside. This was the first time that these people had been allowed to get together, so they were really raucous and really enjoying themselves and having a great time. So this was up in Liverpool. It was a giant warehouse, and it was so big that we had to put 33 sensors around the venue. And you can see with the red arrows there's some of our sensors on the walls. Obviously, we weren't able to put sensors right in the middle, but we did have to put them on the walls. And we put them in cages because we were quite concerned with a lot of drunk, excited people. They'd be ripping them off the wall and going crazy. So as I said, it was a really big venue. It was 160 meters long, quite a large volume inside, and with quite large ventilation openings. We had 7 by 7 meter doors. So when we did our initial walk round, we thought this is going to be fine. There's going to be plenty of ventilation. We're right on the coast by the River Mersey. We're going to get lots of wind-driven natural ventilation. There's going to be no problems here. We had a dance floor at one end and a bar area down the other end. And then right before the event, things changed. The venue organisers lowered the door height and then put butcher's screens, so plastic butcher screens. And this was designed to stop noise leaking out of the venue. So one of the licensing requirements was that they had to prevent too much noise from leaking out of the venue. So here's another example of a butcher screen. I think you can probably imagine where we're going with this. Suddenly we've reduced the size of the ventilation openings. So here's some of the results that we saw. So the purple line is the one that I'll draw you to most, because this is the front end of the dance floor. And here we've got CO2 concentrations, which over the course of the event increase up to close to 2,000 parts per million in some parts. Compare that to the yellow line, which is the bar area right down at the bottom of the warehouse, where there wasn't very many people. We had actually very low CO2 concentrations. So basically, if you're standing at the front, you're going to be exposed to a lot of exhaled breath. If you're back in the bar having a drink, you're probably going to be exposed to much lower exhaled breath. We also noticed something quite interesting on the second day, was that about 5:30, 6:30 and 8:30, there was these drops in CO2 concentration. And we looked at the DJ schedule, and this was the point when the DJ was changing from one set to another. And what was happening was people were rushing out of the doors, opening the butcher's screens and increasing the ventilation rate and reducing the occupancy at the same time. So what this told us was actually, potentially, had those doors have been open, we wouldn't have seen the high CO2 levels that we did record. But if you want to be exposed to lots of other people's exhaled breath, potentially virus-laden aerosols, the worst place to be is in that top right-hand corner, right by the stage. And we're really pleased because for the first time in history, perhaps, we were having ventilation research on the front pages of the newspaper, which was really good to see. I'll contrast this with another type of event now. This is a music festival, quite a different environment. You can see, rather than being in a closed-off warehouse, we had a big open circus tent. You can see through to the other side of the venue there. Again, we put our sensors all around the venue, and I've got my red arrows here showing you where we can see the sensors in the event. I'll show you some of the data from where that red arrow is now. So you can see, again, just like the nightclub, a lot of people are densely packed together. But here, we generally saw much lower CO2 concentrations. So the provision of ventilation that we were getting in this tent compared to in the closed-off nightclub, we assume was much better. Obviously, the occupancy was slightly different. There's another sensor right in the bottom of the left-hand corner. You can see this image. I'll show you the data from that now. So contrast that in your mind from when the nightclub was right at the front. Here we saw at the front very low CO2 concentrations. And again, this is because we had a completely different ventilation scenario in this tent to that closed-off nightclub. And here's just a show of where we were. We were in a big open field right next to East Midlands Airport. There was plenty of wind rushing through. We had 3 open sides on this tent, plenty of cross ventilation. One thing we didn't look at so much in our study was the fact that when people are going to be in close contact, there's going to be a lot of droplet transmission. People are going to be dancing, and they're going to be shouting, and they're going to be singing. And so potentially there's going to be viral transmission through these close contacts and droplets rather than through the airborne transmission. But that was really out of the scope of what we were looking at. As I said, this was just a rapid assessment for the government just to risk assess whether or not they could open these events. And once again, we got on the front page, so we were very happy with that. So just to finish off now by contrasting with a more of a serene environment where everyone was nice and neatly sitting in their chairs. We're in a mechanically ventilated theatre here. We saw a slightly different a trend here. So where you were sitting in the stalls, which are the blue line, and the mechanical ventilation system was obviously operating throughout, we saw generally low levels of CO2 concentrations here. But if you're sitting up above in the balcony area, this is where we saw high levels of CO2 concentrations. And this is because the ventilation was supplied at low levels under the seats in the stalls area before it rose up. So again, as we saw at the nightclub, we see the same in theatre. If you're in a different part of the venue, your risk exposure to exhaled breath changes. One of the key things we also identified with this venue was that if you have an interval where people are leaving the venue, that's a good way of reducing those CO2 concentrations during an event. So just to finish off with some of our recommendations, we've recommended that venue and event organisations consider their ventilation strategy in relation to the occupancy, the way the occupants are using that space and where they're occupying the space. But also, I'd like to just draw your attention to the impact of our work. So ultimately, our work was, it enabled the government to risk assess the reopening of mass gathering events in the UK for the first time since 2020. And it was also the cause for the Scottish government to delay the reopening of nightclubs in Scotland. So sorry if anyone's from Scotland who wanted to go to a nightclub at the end of the pandemic, that might have been our fault. So just to draw your attention to some of our sponsors, and to say, if you're interested in reading more about our work, here are our publications. So thanks very much.
That's great. Thank you, Ben. And I think your work there really shows that in these very large venues, those assumptions that we all tend to make, that, you know, the air's well mixed, it's definitely not true. So, I mean, I just wondered, you talked a bit about guidance there. Is there any thought for whether you'd actually really need different types of guidance for different types of venues here, because there's some very different venues that you've looked at?
Yes, I think it's both the venues themselves and the way they're run, but also the types of buildings that they're occupying. So a lot of the in the events research program, about 75% of the venues were purpose provided, designed to host mass gathering events, but about 25% of those were repurposed venues from other types of use. So we had a change of use with insufficient consideration for the occupants and the ventilation that would be needed. So I think if guidance can be where there's a change of use in a venue to upgrade the ventilation system or consider the ventilation in place, I think that would be a really important step.
That's great, thank you. Actually, one more question is, I mean, you very much focused on the CO2 in some of the large venue spaces, but I think I'm right that you also looked at some of the sort of smaller spaces like toilets and atria, walkways and things like that. And is there anything you would comment on those?
Yes, we've got a conference paper on toilets, which was quite interesting. So one of the interesting things we found, and it's not particularly surprising, was that depending on the gender balance at events, you saw a completely different scenario in the toilets. So for example, at the Wembley Arena, the FA Cup final, the men's toilets, the CO2 concentrations were obviously way higher than the female toilets, whereas the Brit Awards, which had a higher portion of females at that event, had a much higher concentration in female toilets. And it was also depending on the way the event was run. For example, the football event, there were peaks before the game at halftime and after the game, whereas at the Brit Awards, people were able to go to the toilets any time. So we tended to see a much flatter profile of CO2 in those kind of spaces.
That's great. Thank you ever so much for that. So let's move on now to our last speaker of this session, which is Dr. Matt Butler. And Matt is a consultant physician at Cambridge University Hospitals, and he's going to talk to us about the work that they've carried out at Addenbrooke's on air cleaners. So over to you, Matt.
Thank you very much. I'll just see if I can get my slides up. Is that full screen?
It is, yes.
Perfect. So yeah, thank you for inviting me to talk here. So I'm a little bit out of my depth when it comes to an engineering perspective, because I'm more used to wielding a stethoscope than a anemometer, although I had to learn both for this. So I'm going to talk to you about our Addenbrooke's air disinfection study, which started in the mid to sort of late 21s, and then finished only just last year, and has just been published the results. So I'm going to tell you a bit about how we designed the study, and then I'm going to show you the results from the two arms of the study, basically the environmental arm and more excitingly probably the clinical outcomes arm. And then I'm going to just give you some summary sort of take-home points that I think are relevant going forward. So the study, so about the complexity of this slide, but essentially it was a before and after intervention study. We deployed these large air cleaning units supplied by Air Purity. So we had per ward 4 Aerotitan 2000 units, 1 in each of the 6 bedded bays, as shown on this bottom middle figure, and then 2 large Aerotitan 3000 units in the corridors on both intervention wards when the intervention was on. We also looked a year prior to the implementation to basically get a baseline and to use to act as an own internal control, and we matched them with similar wards where we didn't do any air cleaning. And just to highlight the importance of this, so I was obviously on the in hospital with the first COVID wave, and it's estimated that around 26,000 people caught COVID in hospital, which, when you consider the mortality rate for hospital-acquired COVID at this stage, was 10%. That's a lot of inpatient mortality. And just a bit about the units, we used heparin UVC. That wasn't my decision, that was the decision from the Estates Department. They opted for the safest that they saw at the time, and without being clear of which technology was going to give the best bang for the buck, they wanted the hybrid units. So just looking at the indoor air quality, we deployed lots of sensors on all of these wards, and not surprisingly, we saw PM 2.5 levels. So if you look at the bottom left graph, the orange is when we don't do air cleaning and the blue is when we do air cleaning. And we generally saw much lower levels when the ACUs were working. Interestingly, which I'll talk a bit about later, we saw differences. So the differences were more pronounced for our first ward, which we turned on in September of 21, compared with our second ward, which we turned on in March of 22. And as has already been alluded, our external particulates seem to drive internal particulates, even though these wards were up on the 6th floor. And we saw a spike in March of 22, which coincided with a dust cloud from the Sahara. We didn't see any difference as expected with CO2 on the no ACU and ACU conditions. And like in schools and other events, other places, we also saw high CO2 levels in the winter months, particularly January to March, when it was very cold. Just looking at temperature, I know this is not necessarily relevant for some measures of indoor air quality, but very relevant for quite a vulnerable frail patient cohort. Interestingly, we saw that the wards generally were very hot throughout the whole of the year, irrespective of what the external temperature was. And Cambridge actually, during this study, acquired the UK record for the hottest day of the year on record, which was 39.9 at the Botanic Gardens in Cambridge. And on that day, we saw averages, bearing in mind these are 24-hour averages, so from 8 AM to 8 AM the next day, of well over 30 degrees C, which was quite challenging for our patient population. And then perhaps more relevant for what we know now about SARS-CoV-2 transmission, humidity seemed to be particularly low for the majority of the year. If you believe that the range that we should be aiming for between 40 to 60%, and levels lower than that, drying out mucous membranes and making us more susceptible to viral infections, as well as affecting sort of the way that the aerosol particles can shrink and be more transmissible. We found that the hospital ward air was very dry, but it did gradually increase over up towards September and then dropping down again. What we think is happening, because air seems to be the component where if you remove it, all the relationships drop out apart from the worktop and the sink. That the air is acting as the mechanism of or the vehicle or the fluid in which these particles are being transported through, and then they're depositing. So the surfaces are basically an integrator of airborne exposure. What we interestingly saw also was that, I haven't shown this data because it's currently in draft, but the air cleaners actually didn't affect the sink, which you'd probably expect, because it's more likely that the sinks are contaminated from the drains and from hand washing, rather than the worktops and the floor. The worktop was the high contact surface, but the floor was done where you would expect less contact to be. So certainly no footfall and no handborne transmission. And just to show you what it actually looked like in a crude form, so these are in the top right, these are our aerosol cartridges. On the left-hand side is a fresh cartridge. On the middle is on the intervention ward, so when we did the air cleaning, and after 24 hours, and on the right-hand side is the aerosol sense cartridge after 24 hours without air cleaning. So quite a lot of gunk that we've removed from the air. So I'd much rather not be breathing in all of that. We finally, I know this is probably the odd way to do it, but we'd concluded most of the study, and then we did some CFD, bearing in mind this was a pandemic, and we basically had to get the machines on the ward as quickly as possible in order to try and demonstrate an effect. What we saw with air cleaning when we did quite complex CFD when we simulated 7 infected patients on the ward. I hope you're appreciating that this sort of bottom right figure, that the particulates are a lot lower, particularly within the corridor spaces. Compare it to the bottom left, where the concentrations are generally higher. But I think you also appreciate why in such a large open environment, even when you've effectively increased the air changes by an order of magnitude. So we went from 1 air change plus a marginal degree of natural ventilation, because all the windows were closed to were restricted to prevent people jumping out. So it was only 1 air change going up to 10 air changes with the air cleaning. That obviously it's not just about how much you do as in turnover, but probably also where you site these machines, and we were very restricted to where we could put these machines. And then the top just indicates just how much mixing there was. You can see that we generated much more mixing, which to some degree could be a problem. And we did actually see that, particularly in the corridor units, that the particles were being pushed further along the corridor, although to a much lesser concentration. And then finally, just to end on the clinical outcomes of the study. So this has just been published last month. So in total, we were able to recruit just over 6,000 patients. Our power calculation subsequently, when we found how spiky and disparate the outbreaks were, we estimated that to conclusively show an effect, you'd probably need double that number. But in any event, what we showed, at least the trend of lower hazard was going in the right direction, with a hazard ratio of 0.78, although it's important to note that this crosses 1, so there's the potential that the overall study could have been compatible with an increased risk. However, if you look at the Gantt chart, which is this bottom middle chart, we weren't just measuring the HEPA, ACU, UBC units. There were lots of other things that were changing at this time. So if you look at the green bars, at Addenbrooke's, we used to screen every single person that was being admitted. And that practice was stopped as soon as the second intervention ward was switched on. Not because of that, but partly because of the difficulties in running COVID and non-COVID pathways, which is the second green bar from the bottom, which also stopped at the time that we turned on the second intervention ward. So we did a caution with this is not an a priori analysis. We did not pre-specify that we were going to do this. But in light of this, we thought it would be interesting just to restrict to the first ward pair when you were doing all of the other mitigations. And we did actually see a significant difference, but there's real caution with interpreting that result, because we didn't, before we set out to do the study, pre-specify that we were going to do that. Interestingly, also, there's this little built line graph into the top middle graph, just showing that compliance actually massively reduced from around about 77%. So this is basically if the machines were switched on, to around about 50% of the time. So what we were finding was that the willingness to sort of put up with what are quite noisy machines, which are around patients that have to sleep to get better, that we found that these machines were switched off. So that wasn't to say that the staff were being negligent. That was just we appreciate that this is a difficult situation to control. So I think what we can be confident in is that air cleaning units reduce particulates, which we'd expect. We can be confident they reduce bioburden and deposition onto surfaces, which is a benefit. Given the billions of pounds that we spend on hospital cleaning. We could also show via CFD that it reduces inhaled dose. With caution, I'd suggest that they may also reduce viral infections, in our case SARS-CoV-2, and they may suggest that effectiveness is linked to whether or not other infection prevention control mitigations are employed. I'd just like to thank, it obviously wasn't just me, there's a huge team involved in this, and also thank you to Air Purity for supplying the machines, and Assault Systems who did the CFD. Thank you very much.
Thank you, Matt. That was fantastic. Really good to see. And I mean, I think it just shows how, however much we need this data, it's also really hard to get this data from these sorts of studies because they're really complicated studies to do. And, so many things change in the process of doing it. I wonder if you can say any more about the noise side of things, because I think you did some sort of surveys around that as well. Am I right?
Yeah, so we did quite a number of patient surveys. So we in total interviewed 100 patients and 50 staff. And what we generally saw is that the patients minded it less than the staff, which was interesting. And I think that was probably to do with they were constantly exposed, whereas the nurses were going towards and away from the machine, so they could notice the noise difference more. The decibels that our machines produced were just at the limit of HTMs if you measured them at a meter, so they were quite loud. And interestingly, our second ward machines were more powerful, so they were about 20% more powerful. But I think obviously we'd gone past the sweet spot at that point because they were then switched off more, and that potentially also reduced the effectiveness on the second ward. So I think ultimately implementation is as important as showing a clinical effect, because if they're not going to be switched on, there's really no point in having them.
That's great, thank you. There's a couple of questions. One, I don't know whether you know the answer to this one, but do you know what CFD tool was used in the study?
I don't, but it's called PowerFlow, and it's the one that Dassault System use. Yeah.
Thank you. And then there's a question about, do you have any reporting on staff compliance?
Staff compliance as in infections, or staff compliance as in whether they keep the machines on, or?
I'm not sure. Maybe a bit of keeping machines on. There we go.
Keep machines on. Yeah, well, I mean, we interviewed the staff, and they're the ones that found the noise more challenging. I think the other thing to point out is because we went through a heat wave, the NHS has not been built for all these digital devices. Addenbrooke's is completely digital, so we do not have enough power sockets for all of the computers that we have, and we're constantly walking around with these worktops on wheels to do our ward rounds. And so when air conditioning has to come in to cool the wards down, then sometimes also we saw that the machines were then switched off because of that.
It's interesting. I mean, we've hit similar practical challenges in schools that there are not enough plug sockets to do what you need to do. So thank you very much for that. Really, really interesting and informative. And I say thank you to all of our 5 speakers for presenting some really interesting data on the studies they've done. I'd now like to move on to the second part of this. So for the last 25 minutes or so, we're going to move into a panel session. So I'd like to invite the people who are on that panel. We've got Matt Clark, Doug Booker, Sarah West, Malcolm Cook, and Kate de Selincourt. If you could perhaps put yourselves on the screen and unmute. And I'm just going to go around and ask each of those people to start with just to do a very quick, just say who you are and maybe a very quick introduction about why ventilation is important to you. So I'm going to go to Matt first, if you want to start, Matt.
Hi folks, I'm Matt Clark from Hertfordshire County Council. I'm the Air Quality Programme Manager there, and have a real interest in this agenda item because of the internal air quality aspect, particularly which is that interface with the kind of the physical air pollutants, I suppose, what I would call, rather than the pathogens. But at the same time, as I work in a public health service at the County Council, that internal pathogen loading is also very interesting to us. Thank you.
Thank you, Matt. Doug, over to you.
Hi folks, and yeah, thanks for all the amazing presentations. I'm a lecturer in indoor air at the University of Leeds, and ventilation matters to me so much in my research because I'm really interested in looking at who is exposed more or less to poor air quality, and that sort of information we don't have as much indoors, and ventilation is one of the key mechanisms that is going to determine that exposure.
Thank you, Doug. Sarah.
Hi everyone, I'm Sarah West. I'm a professor at the University of York, the Stockholm Environment Institute, in citizen science, and I'm involved in the SAMI project that Sam Wood talked about right at the top of today's session. And we're interested in ventilation because there's real links between CO2 levels in high CO2 levels in classrooms and attendance at school, and also attainment. You know, we know that high levels of CO2 leads to drowsiness, feelings of not being able to concentrate, headaches, etc., all of which creates a bad environment for learning. So I'm interested in ventilation from that perspective, is how can we make our CO2 levels go down, but also what are the kind of disbenefits of ventilating in terms of what might be bringing into classrooms. And that's some of the things that we're exploring in SAMI.
Thank you, Sarah. Malcolm.
Thank you, Kath, and good afternoon, everyone. And thank you for some really great presentations this afternoon. So I'm Malcolm Cook from Loughborough University. I'm a professor of building performance analysis. Spent most of my career looking at natural ventilation, design for natural ventilation, how to control natural ventilation, and computational fluid dynamics modeling of ventilation. I was also part of the AirBods project that Ben spoke about earlier on. Why is ventilation important to me? I wrote 3 pages thinking about this afternoon, and I can summarize it in one word, and that is health. I think it's highly irresponsible to build homes or let homes that have inadequate ventilation. Abigail talked about dwellings being a safe space, buildings being a safe space, and Tim showed some really shocking images of what happens if we get ventilation wrong. So for me, it is about healthy environments. Thank you, Kath.
Thank you, Malcolm. And Kate.
Hi, so I'm Kate de Sellencourt. I'm a researcher and writer, and I do quite a lot of work with the Passive House Trust. I suppose my interest in ventilation is, as Malcolm says, it's because it's so important for health. I'm also particularly interested in things like the way that fuel poverty and cold homes and under ventilation kind of play into each other, and when people are cold they're more likely to disable their ventilation. And I suppose coming from Passive House, where it's very important that ventilation is effective and quiet and warm, you know, I'm aware that even if you've got installed ventilation, if it's uncomfortable, you might as well not have bothered, because people are just going to disable it.
That's great, thank you. So I've got a set of questions that I'm going to ask various members of our panel, but if people do have things that they would like to ask, please put them in the chat. I will do my best to kind of monitor all the bits of this and see if we can get some good discussion going today. And I'm going to start off by asking, you know, a question about, you know, we've heard a lot about some of the challenges, and we've seen some of the issues with poor ventilation, but how can we actually help individuals and organisations to better understand the need for ventilation and good indoor air quality? And I wonder whether perhaps Sarah, I could come to you first on this one, as I know you've done a lot with schools around this aspect.
Yeah, thanks, Kath. I mean, I think the fundamental thing is that ventilation is not at the top of anyone's priority list, right? They just don't know. You know, they're dealing with, thinking about schools like they're dealing with poor behaviour, trying to get kids into schools, trying to teach them maths, trying to teach them English. You know, they're not thinking about how ventilated are my classrooms. And so I think it's really about us all in working in this space, raising awareness of the importance of good ventilation, what that looks like, and really importantly, what people can do to improve their ventilation, and giving practical tips, and those tips being really realistic. So, you know, like a lot of schools we see is that actually, you know, their windows have been painted shut by somebody at some point in the past. And so kind of getting people to kind of even think, I need to have a look at my windows is a really important first step. And I think initiatives like World Ventilate Day are really important for that, you know, raising the awareness of what is this thing called ventilation? Because unless you're in this world, you don't really think about it at all.
That's great, thank you, Sarah. And I can see Malcolm would like to add to that. So Malcolm.
Yeah, so I don't like talking about good things coming out of the pandemic because it can be misinterpreted, but throughout my career until the pandemic, trying to persuade people to think about the importance of ventilation was really, really difficult. You can't see air, you can't see stale air, and you can't smell it. So it took a global pandemic to understand the importance of ventilation. You know, so at least we've got people talking about ventilation now, and we're able to, you know, a lot of people have or CO2 sensors, so they're able to see a correlation between their actions or their alertness and opening and closing windows. So, you know, I think we've got more awareness now than we've had before, which is good.
Thank you, Malcolm. And I just wondered whether, Doug, could I come to you and just ask whether you would like to make any comment there around, particularly around inequalities, because I know this is an area that you work on quite a bit.
Yeah, so anytime, I think this was touched upon by Tim in his presentation as well, where we, in some instances, put too much of an onus on the individual to fix their ventilation. There's clearly an educational piece that can be done to help people meet them where they're at in a language that makes sense to them and relates to how they live their life, to help shift social practices to improve ventilation. I mean, you can look at examples from countries like Germany, which have their Stoßlüften, where they air the house in the morning for 5 minutes in the morning and evening. And that's not people necessarily thinking scientifically about ventilation. That's them getting a feeling of having cleaner air within their home. I think it's also the other educational piece is we want to be empowering people that maybe don't have the agency for ventilation, whether that is in having a negligent landlord who isn't fixing a ventilation equipment that they've got in a bathroom or kitchen, or poor outdoor air quality, that they know who to go to raise a complaint, and also that they'll then be listened to. So that educational piece can both be about empowering them to make the change, but also knowing who to go to so that they can.
Thanks, Doug. I think, Kate, did I see you wave as well?
Sorry, I can't see the button to raise my hand properly and politely. I don't know where it's hiding on my screen. Yeah, I just sort of flowing from something in the chat, and also something that Sarah mentioned. I think when you're trying to increase people's interest in ventilating, particularly institutions and companies, to make people more aware of the sort of commercial and operational benefits, you know, in cash terms, in terms of productivity and, you know, where you are in the school league tables and staff absenteeism. I think, you know, we've got enough science on that now to actually be able to turn that into numbers and put it in front of people that way.
That's great, thank you. I'm going to perhaps come to Matt on the next question, which I'm going to ask is, where do you think some of the highest priority spaces where we need to intervene, and how can we enable it? You know, there's plenty of challenges and barriers in there. How might we do some of this?
Yes, good question. I think inequalities has been mentioned already. We know there's inequalities in health, but we also know there are certain people in our society who are more at risk to the effects of air pollution, and also maybe more at risk to the kind of bigger impacts from exposure to pathogens. And those at-risk groups may be the same. So younger children, older adults, those with underlying health conditions. So if we think about those groups of individuals as a collective, where are those people spending their time? And I think that's something we should be considering. So schools has been mentioned, and Sarah and co doing good work in that space. But also, what about care homes? Hospitals has been mentioned. I think that's an absolute given, that these spaces are where we have poorly people, and poorly people need the best to get better. So that seems like a no-brainer. But what are we doing in the care home space, where we're kind of collecting all our vulnerable people, and often seeing outbreaks that have really dire consequences when they run through that care home environment. And as to who we need to be speaking to maybe about this, well, I work for a local authority. I'm a local authority person. We're building care homes sometimes. We're building schools, and we have public health services who are interested in the types of statistics and information and research that has been presented today. And we may also be able to go, or be more willing to go further than a minimum standard in the building regs if we are presented with the information, because we have directors of public health.
That's great, thank you.
For the right
I'm going to hold that thought and come back to you in a moment on that one, but I've just wondered whether, Kate, you might like to respond to that one as well about the highest priority spaces.
Yes, I mean, I think inequalities is such a huge part of this, and I think there's a lot of accommodation, residential accommodation, that's a lot more densely occupied than what the building regulations anticipated, and one thing that really bugs me is the fact that we spend money on insulating houses to tackle fuel poverty, but there's no money associated with it for, like, if you like, clean air poverty, and a lot of the people in fuel poverty are just because they're in overcrowded accommodation, and then because they can't afford a tumble dryer, so they're drying their laundry over the radiators. Tim Sharpe's people have done some interesting work on that, and you know, they're not there. They need the best ventilation, and they often have the worst. And yet, if the landlord or the eco grant people try to put in good ventilation into these dwellings, it's not properly funded. You know, we're calling it carbon money. It's not really for carbon. It's actually for people's well-being when it's homes in fuel poverty. So why we don't pay for upgrading ventilation again, I do not know.
That's great, thank you. And actually, you know, what you and Matt both touch on there is we are building, or we're spending a lot of money on retrofitting new things, and if we don't get the ventilation right, we lock that in. We lock that poor quality in for the next 50 years or so. You know, the government has announced money to build new schools. I think that's fantastic. But if we lock in poor ventilation standards in those new schools, then we won't move forward in any way. So I think that's some really important things. So maybe there's now a question, which I had a question on this, but there's also one in the chat as well about a sort of, I guess it's like opportunities in terms of regulations and enforcement, and you know, how can we have perhaps a push on this? And particularly now we've had the Hackett inquiry, is that an opportunity to respond on regulations and to, you know, where should we be looking to improve on regulation or on how we enforce? I don't know who might like to start on that one, if anybody's got a willing hand. Perhaps I can go to you, Malcolm, as a start.
I'll have a go, Kath. Yeah. So I think it was Doug raised the point about in Germany people opening the windows and flushing the space out, i.e. it's part of the culture. It's not part of the culture in the UK. I know this is World Ventilation Day, but forgive me for speaking just about the UK for a moment. It's not part of the culture. As I said earlier on, people simply didn't talk about ventilation. They didn't acknowledge ventilation before the pandemic. So I think we need something in regulations. I think mandating air quality sensors, in particular CO2 sensors, in the same way smart meters are being used, would be a great way of making people aware of when a space needs ventilating. I think we need to understand how we can do that manually. So it's not about opening a window and leaving it open and everybody feeling cold and consuming a lot of energy. We might open it for a few minutes and then close it. If we've got a CO2 monitor in the space, which has been mandated as a result of regulation, then I think that gives us a real leap forward.
That's great. Thank you, Malcolm. And I'm going to go to Matt and then to Doug. You've both got hands up.
Mine's very quick, you'll be happy to know. Off the back of regulation and enforcement, local authorities are really quite good at regulating when they've got a standard. and when they've got the resource and the dictat to go and do. So I would always advocate for our environmental health services, which are going out doing housing inspections. They are really good. There's some really knowledgeable people there, embedded into the local place to go and deliver. But they need a sensible standard to be doing that against. I think that's the thing we've got to get right. And I would encourage, if those standards are being looked at, bringing in that regulatory arm to be part of the discussion and contacting institutes like the Chartered Institute of Environmental Health to bring them in to help form and push for what we need.
Brilliant, thank you. Doug?
I agree with everything that's been said. I think the challenging bit of this question is the enforcement. We've had a performance gap in ventilation, which has been well known for a long time. And I am a big advocate of CO2 sensors. There are other brands. And we've got these starting to come into regulations in the UK, in bedrooms in Scotland, for example. I don't have an answer for what an appropriate enforcement mechanism is. It'd be really interesting to see what other members of the panel and those in the audience think. But for me, that is the big...
All it said was severe delays.
For me, that's the really challenging part that we need to be discussing. How can we deliver on what we've already got in terms of regulation?
Yeah, I think it is a big challenge, that one. Go on, Kate, as well.
I'm just quickly going to say what I put in the chat, which I think proper commissioning, where installers don't do their own commissioning, where it's third party commissioning. So someone actually comes and tests, and including noise. I mean, it's hard to actually measure noise from a ventilation system because it shouldn't be noisy enough for regular equipment to detect it. But I think there could be a subjective measure in there if you've got a third party professional, a ventilation commissioner.
Yeah, that's great. I'm going to move on to a slightly different question now, which is, I mean, all of you have had experiences of working in different environments, and in your experiences, what are some of the things that help get messages across or help get interventions be successful? And Sarah, I'm going to come to you first on that one, if that's okay.
Yeah, thanks. So I think, like linking to what my answer was previously, it's about raising awareness of the issue and showing people the air quality in their spaces. And we're working in schools on the SAMI project, but also homes in Bradford on the Ingenious project, is so important for them, realising that there is something even to think about. There's something in there. But also thinking about when certain behaviours are triggering certain responses on that CO2 monitor. So, like, oh, suddenly I've got lots of people in the room, my CO2 levels have gone up, maybe I should open the windows, kind of thing. And I think using that, we use a citizen science approach, which is where you get members of the public to help collect data. And the advantage of doing that is that as researchers, you can then get data from schools, homes, offices, wherever, places that you wouldn't necessarily or as a researcher be able to get into. But the real benefit, I think, and the kind of like superpower of the method is that you raise awareness of the issue whilst you're actually collecting that really valuable data. And in SAMI, we've had teachers telling us that they've taken part in the project, they've seen the data visualizations that we've got within the web app, and they're actually like thinking about air quality, and they are opening windows, and they're noticing when their pupils are getting tired. We had a great school who actually had gone, a group of year 9s had gone and done their own little project where they'd looked at the monitor readings and they'd compared it to did a little survey on how people feeling tired. And yes, in the afternoons, everyone was feeling really tired, and that was because the CO2 levels were high. And so at lunchtime, they needed to ventilate. So I think that kind of like showing people and letting them experience it themselves rather than just telling people what to do. People don't like to be told what to do, right? So showing them and giving them actions that they can take themselves, I think, is really important.
That's great, thank you. I see, Malcolm, did you have a hand at that one as well?
I didn't. I was applauding Sarah's point, actually.
Okay, I wonder whether you might be able to comment on things that work, maybe more from a technical perspective as well.
Yeah, okay. So what I was going to say just there was I've led some school assemblies, and children, in the same way as teachers, are absolutely fantastic at taking the message home. So yeah, technical interventions. Yeah, so I think one of the problems, one of the criticisms that quite rightly gets levied at me when I talk about opening windows is, yeah, but it's cold. Yeah, but I've got to turn the heating on. So, you know, we've got to get that right. Again, particularly in the UK, where I don't think we do this very well. I've just come back from Scandinavia, where they build tight, they ventilate right. You know, throughout Germany, they do it well. So this isn't rocket science. If we need openings, okay, whether they be damp controlled openings, whether they be windows, whether they be doors, trickle vents, whatever. We need openings. So it's about putting them in the right place. So in the winter time, we don't want that air coming in at low level. We want it coming in at high level. Thinking about natural ventilation here, we want it coming in at high level, so it's going to mix with some of the heat we already have in the space. So it's about thinking about where we're going to bring this air into the space, and putting adequate controls in to open, and as importantly, close it when we don't need that ventilation.
Yeah, I agree, and it's there's no single right answer. I think there's a lot of, the answer for one building is different for another building, and really
Exactly.
accept that.
Yeah.
I'm really conscious that we've gone through this really quickly. We've only got 4 minutes left, so I would just like to finish today by asking each person on the panel to say, if you could give one tip today to the audience about ventilation, whether that's how to improve it in their own home or their workplace, or even that they could do to try and get better change at regulatory level. What would your one take-home message be from today? And I don't know who would like to start. Is anybody's got a message ready? I can see Matt has unmuted, so that gives you the starting point, Matt.
Yeah, mine's very simplistic, maybe, but I think it's to understand where you may have your biggest sources and what the biggest sources for your space may be. So in the domestic environment, that may well be domestic cooking with gas, particularly. So know that that's your biggest source. So when do I need to ventilate? When I'm doing that, and for a period after.
Right.
The same might apply to Clean Air Night is all around domestic solid fuel burning, by the way, the logo behind me. We're coming into that season. Again, similar approach may be required.
Right, thank you, Matt. And Doug, you've put your hand up, so you can go next.
Matt's smart. If you go first, that means your idea can't be stolen. I was going to say, you know, if we talk about a hierarchy of control, removing the source comes first, but considering we're talking about ventilation, you know, sometimes it's helpful to repeat the message, but agree with Matt. Think about what the main sources of poor air quality are for you in your indoor spaces, and then think about how you can ventilate better to minimise them.
Thank you, that's great. Malcolm.
I had to get my hand up earlier and I pressed the wrong button. Anyway, quite similar to what Matt said, actually, but it is different. And that is, go home or go into your office space and figure out what the ventilation system is. Because in the work I did with Ben and others on the AirBods project, it was staggering the number of places we went into where people didn't know how their space was ventilated. So know how your space is ventilated.
Right, thank you. Kate?
I'm just going to say what I said before because it's so important, which is just to integrate ventilation into the low carbon agenda, because you're in the buildings, just don't ignore the ventilation.
Perfect, thank you. And Sarah, do you have anything to add?
Yeah, just linking to the kind of earlier points about, you know, knowing what your sources are that might be causing poor air quality, is use your nose. And that doesn't always stand true, but actually see what you can smell. So that might be like wood burning, it might be cigarettes, it might be strong perfume, it might be cleaning products. Use your nose. And also just think about whether you're feeling like headachy, like, you know, that feeling of stuffiness. And I think we just need to like sit sometimes and just think, how am I feeling, rather than busily going around our lives. And that will give us a good idea of whether we need to open our windows or not.
That's great, thank you. It is almost 3 o'clock, so I would just like to say a really big thank you to all of our speakers and to our 5 panelists for this afternoon. I think we've heard some fantastic research, we've heard some really fantastic discussion. I think we could have gone on for considerably longer on that discussion. I mean, we've really only scratched the surface, but you know, it's been a fantastic event. Thank you to the audience for putting questions in. I can see an awful lot of those questions have been answered, but we'll just have a quick look and see if there's anything that's missing in there. You know, please go and enjoy the rest of World Ventilation Day. Go, and if you've not celebrated ventilation properly yet, go and do some ventilating now, because that's a really important thing to do. You know, go and, if nothing else, go and throw your windows open for 10 minutes, like as Doug suggested. So thank you all, and yeah, very good to see everybody.